So there haven't been very many studies looking at the risk of concussion, specifically increasing risk for suicide, but concussions do certainly increase risk for depression and behavioral problems down the road. A lot of the studies have really looked at patients who've had severe head injury, and when they're recovering from it, they're more irritable, they're more anxious, they can be more depressed, and it certainly puts them at higher risk for both depression and other types of behavioral acting out problems. And this poses an issue even in rehabilitation, in that they're harder to rehabilitate as a result of that. So the most sensitive indicators of a concussion are the patient's sense of how they've recovered. So if they're complaining of trouble with concentrating, if they're having headaches, if they're having dizziness, those are very sensitive indicators of problems. Unfortunately, with athletes and football players, there's more of an onus to minimize those symptoms because otherwise they're stopped from playing. And in those circumstances, it's particularly important for whoever's in charge to let the player rest out the game.